good morning, everyone. Uh, we have been told that we have just celebrated our World Diabetes Day recently. It was on the 14th of November. It coincides with the Children's Day. So we had called our type 1 diabetic children, less than 18 years of age, who suffer from diabetes, and we had organized many events on the day. And the motto for the Diabetes Day for this year is knowledge for managing diabetes. So it is how we arm ourselves with the knowledge of diabetes so that we can prevent diabetes, we can take care of diabetes, and we can have a healthy life along with the diabetes. So that is what the International Diabetes Federation and the WHO want to highlight. It is the knowledge because we know that knowledge is power. If you know things, if you know how to do them, if you know why, it is only then that your mind will accept things and then you'll be able to do it in a better way rather than just doing it haphazardly. So today, just share my screen. Okay. So today, what I wanted to speak was what everyone needs to know about diabetes, the basics, the basic of the basic of diabetes. But then, in my clinical practice over the past few years, I have noticed a recurring set of questions from the patients, which they usually ask regarding diabetes: what foods to eat, what foods to avoid, when to eat, how to eat, what exercises to do, which are safe, which are not safe. And then I thought that I would just change my topic heading to what everyone wants to know. So here, what I plan is I'll speak for a couple of minutes. I'll try to tell whatever I can in the simplest of the ways, in the simplest of uh, the language, so that everyone understands what I'm trying to say. And then later on, I would like to take as many questions which people have. I'm sure that everybody has questions about diabetes, and they might be very simple to very complex questions also. But we'll try to answer everything. So, what I want to speak is what everyone wants to know about diabetes. Only thing I would like to tell is that uh, each person is different. First thing. So, one thing which may apply to one person will not apply to everyone. Some person will respond in some way and the other may not respond at all. So what is important with regards to management of food and management of exercise is that both of these things should be individualized. You cannot have one size fits all. So that is one thing which I would like to tell everybody at the onset. And then second thing, I would not like to comment upon the other modalities or methodologies of treatment other than what we have been learning, we have been taught as per the medical science. So those are the two things which we can bear in our mind and then we can take forward. So first thing is what is diabetes? What is diabetes mellitus? So in simple words, it is a condition where the insulin does not act in the way it should act. So first thing, from where do we get our energy? The carbohydrates in our food, they are the main source of fuel for our body. So whatever food we eat, eventually it is broken down into glucose, carbohydrates, amino acids from the proteins, and then fats. And eventually, the body has a mechanism to convert these proteins as well as fats into energy or glucose so that it can be utilized by our cells for their day-to-day activity. So whatever food we eat, eventually, it will get converted into sugar or glucose, which can be used by our body. So, where does insulin play a role in this? What insulin does is whatever food we eat, it is digested, it is converted to glucose, it enters our bloodstream. Now, from the bloodstream, the glucose goes to each and every part of our body, and then to make the glucose enter each cell, is the function of the insulin. So if a cell wants glucose for its energy purpose, it will need insulin to push the glucose into the cell. As simple as that. So insulin, it is a hormone which is produced by our pancreas. It delivers the glucose from the blood into the cells, especially the muscle cells, the liver, the fat, where it is reused for energy. Brain is one organ where insulin, it does not require insulin for glucose use. So otherwise, majority of our organs in the body, they will need insulin so that they can take up glucose. So then why and how diabetes happens? So diabetes is like the insulin cannot function properly. The body either does not produce insulin at all. So whatever glucose is there in the blood, it cannot enter the cells. So there is a lot of glucose in our blood, but there is no glucose or no energy in our cells. As a result, despite high blood glucose levels, we will feel weak, we will feel fatigued, we will feel lethargic, we will feel low energy levels, etc. etc. So the body does not produce any insulin from the pancreas. So that usually is the type 1 diabetes, which is usually seen in children, young adults. It is not like it may not be seen in adult population or the old people, but majority of the people who have type 1 are children. And then as the body does not produce insulin at all, the only treatment is giving insulin from outside. Then there is other way wherein the insulin cannot act, in the sense the body produces more and more and more of insulin, but that insulin cannot do its work. This condition is called insulin resistance. So whenever why does this insulin resistance happen? We'll just see in a subsequent slide. So this is the basis of type 2 diabetes. So this does not mean that insulin resistance is the only thing. So the body starts with insulin resistance. It produces more and more and more insulin. The insulin levels in the body go up, but the body is not able to utilize that glucose. The insulin is not able to work. And eventually, with time, the pancreas will fail and it will also start not producing insulin. So eventually, a stage will come just like type 1 diabetes, wherein the body is not producing adequate insulin even in type 2 diabetic patients. So with time, even type 2 diabetic patients will require insulin. So type 2 diabetes, the first stage of insulin resistance is pre-diabetes, and then comes the stage of diabetes. It is usually seen in obese individuals with insulin resistance. We'll just see that in the subsequent slides. Then the other diabetes is the gestational diabetes, which is seen during pregnancy only, and then it just cures itself, or the sugars become normal after the delivery. And then there are other rare types of diabetes, which we are not concerned with right now. So what exactly is insulin resistance? Like I said, that the insulin is not able to act, though there is adequate level of insulin in the body, or even more than adequate. So what happens is when we eat food, body produces insulin. The cells are resistant to the action of insulin. The insulin does not push the glucose into the cells. So that sugar is very often stored as fat in the body. And then again, you feel hungry because of low intracellular glucose levels and low energy. You eat food, and this cycle goes on continuously. What are the signs of insulin resistance? Usually, high insulin levels, it may lead to the blackening of the neck, to the blackening of the knuckles, the underarms, etc. It is called acanthosis nigricans, that is blackening of the skin. Other thing is there can be multiple skin tags. So these are the clinical features of insulin resistance. Even otherwise, obesity, double chin, increased waist circumference, acanthosis, skin tags. These are all features of insulin resistance, which we can see and say that the patient has resistance right now and then is more likely to develop diabetes in the future. So how do we diagnose Diabetes can be diagnosed only with the blood test. So whenever we do a blood glucose level, we can do fasting, we can do it random or 2 hours after food, and we can do an HbA1c. As you all know, that HbA1c gives you the average of last 3 to 4 months of blood glucose levels. So how do we classify? So if the fasting sugars are less than 100, postprandial or post-lunch, post-meal sugars are less than 140, and HbA1c is less than 5.7, we call them as normal blood sugars. If they are from 100 to 125 fasting, up to 200 random, and HbA1c up to 6.4, then we label them as pre-diabetes or impaired fasting glucose, etc. And then above these levels, we label the patient as a diabetic. So this is how we usually diagnose for all practical purposes. What are the risk factors? So these risk factors for diabetes are the same as for insulin resistance also. Insulin resistance, the major risk factor is obesity and overweight. There are a few rare hereditary disorders, but they are very few and far in between, not very commonly seen. More common risk factors for insulin resistance, subsequent development of diabetes, is obesity. So usually we say that it is apple versus the pear. The apple obesity, wherein the obesity is more in the abdomen rather than the hips, is much more dangerous than the pear-shaped obesity, which is usually seen in females. The hips, thighs, deposition of fat due to estrogen levels is different as compared to males, wherein the deposition of fat is more in the abdomen or around the umbilicus and so. So as a result, the apple obesity is dangerous as compared to the pear-shaped obesity. The goal for at least Indian women should be waist circumference less than 80 centimeters and for men less than 90 centimeters. Beyond this, it is a risk factor for development of diabetes. What are the other risk factors? Age, more than 45 years old. Indians, especially Asians, Southeast Asians, are at a higher risk to develop diabetes than uh, other people. Then there are family history of diabetes, which can occur if the parents are diabetic. There is a higher chance that even other person or the children might develop diabetes. Then there is family history of blood pressure, wherein it is seen that the children or subsequent siblings might also develop diabetes. Then there is overweight, sedentary lifestyle, inactivity, history of high blood pressure, high cholesterol, history of diabetes during pregnancy, and history of PCOD. So what I have grouped here is the first four things. These are the things which are usually genetic or the things which are uncontrollable. In the sense, these factors we cannot do anything about. Our race, aging, or the family history and genetics. But then there are other factors which we can definitely take care. It is our weight, it is our activity, which we should be taking care of all the while. So I'd just like to explain once again what happens in type 2 diabetes. Either the pancreas does not make enough insulin, or the insulin which is made, the muscle cells and other tissues are resistant. What contributes more is that stomach, it empties faster, more amount of glucose is absorbed from the food, and then liver. Liver is the storage organ. It stores all the glucose so that when we don't eat food, this glucose is released from the liver into the bloodstream. So liver acts like a sponge. It takes up the glucose from the blood, it stores it, and then whenever this is needed, it just pumps that glucose back into our bloodstream. Similarly, to an extent, the muscles also act that way. What are the usual signs, symptoms of type 2 diabetes? Um, Obesity, like I said, is the most common symptom of diabetes. Then, what are the additional symptoms of diabetes? frequent urination, thirst, appetite changes, and blurred vision. So these are the red flag signs or symptoms which, when occur, most of the people know that they have some abnormality in their blood glucose levels. So these are the symptoms which occur very late in the disease, in the sense that if a person is having these symptoms due to high blood glucose, it is very likely that those blood glucose levels have been high since a very, very long time. The other non-specific symptoms which can occur are tiredness, weight changes, either weight gain or weight loss both, frequent headaches, frequent infections of the skin, urine, lungs, etc., non-healing of the wounds, dry skin, numbness in the feet or tingling. So these are the various symptoms which a patient can present with, and there are also many other things which can occur. Even in the initial stages, the diabetes is silent. So if we want to diagnose diabetes, it is important that we check our blood glucose levels frequently, especially after the age of 45 years. Because I've just said that more than 45 years age, there is a risk factor for development of diabetes. So I'd just like to highlight a few things about what is the burden of diabetes in India. So India has the second largest diabetes population, and every sixth person in the world, diabetic person in the world is an Indian. I just read a recent article in the Times of India where they found the prevalence of diabetes in our city of Mumbai, and 20% of the adult population of Mumbai has diabetes or pre-diabetes. So one in five Mumbaikar suffers from either diabetes or pre-diabetes, and that is a pretty large number. Just looking at the numbers from various Indian states, I have highlighted Maharashtra, where urban population has around 6% and rural population around 5% of prevalence of diabetes. Then what I have highlighted is that the states with a higher standard of living, they have a higher incidence of diabetes. And then the urban areas have a higher incidence as compared to the rural areas. And I know definitely everybody here understands why that might be so. And then just to compare Mumbai, there was a Delhi figure which we had, almost 25% prevalence of diabetes or pre-diabetes. So this is a very, very scary number. And similarly, Mumbai has around 20%. And then diabetes, we have to understand it is not just a disease of the old age. Even younger people can have diabetes. One fourth or 25% of our young population is at risk to develop diabetes because of presence of various risk factors, the most prominent amongst them being obesity. What about development of type 2 diabetes or insulin resistance in our children? If the child is overweight, 50% of those children will become overweight adults. So controlling of the weight should start in the childhood. I think the time is long gone where we force our children to have foods. It is rather now we should keep a check on what they are eating. Children do need their energy to grow. They need it for their activity. But that does not mean that we burden them with high calorie foods all the time. An overweight child will grow into an overweight adult. Almost 26 to 30% of preschool children will become overweight in the due course of time. What is the major thing which is influencing our sedentary lifestyle, which is influencing our food habits? I still remember in our childhood, we used to have lots of food. Even everybody will agree to that. We used to eat so much, we used to do so much. And even right now, even if we eat low quantities of food, it still is affecting our weight. It still is affecting our sugar levels. Why is it? Because the food and the type of food which we consume has changed drastically. We are now more into Western diet rather than our Indian culturally sound diet. We are aping the West. We are trying to follow into their footsteps. Whenever you watch television, you browse through the internet, more than 60% of all commercials are regarding food, and more than 90% of those concern junk food. So our mind is continuously bombarded with all these advertisements, with all these things. The people who we look up to, our movie stars, our cricketers, they endorse all these things. In fact, on the contrary, what they should be doing is telling us how to be fit, how they have become fit, rather than giving us this opportunity or this option of consuming these fast foods, chips, cold drinks, all of these things. They endorse, but they never consume. This is the thing which we have to understand. A person who is telling you to eat something, but they themselves don't consume it at all, then can that be a good thing at all? The other influences which we have, mobile phones, cable television, which have just made us sit at one single place all through the day. In the whole world, India has the highest average use of a mobile phone per day. It's almost 5 hours. So, 5 out of 24 hours, we are on our mobile phone on an average. So, even if we consider that we sleep for, say, 6 hours or so, so 5 out of our 17 to 18 waking hours, one third to one fourth of our productive time, we are spending on our mobile phones. It is just a thing that we should look at, we should deliberate over. Then there is other things, academic competitiveness, which increases the stress levels, where we are always in a race to achieve something or the other, or to better someone or the other. And then the life expectancy. With time, the life expectancy has improved. If a person who would have said that I was a diabetic in 1975, the average expectancy of that person would have decreased by 15 years as compared to normal. Now, with all the medications, all the insulin, the life expectancy of a diabetic is more or less almost similar to that of a non-diabetic, maybe a couple of years here. So, with the advancement of medical science, with the advancement of our life, we are bound to get more diseases which are concerning the old age, and diabetes is also one of them. So the final question which we come to is, okay, there is no insulin, there is no sugar, there is high sugar in the blood. Why do we need to treat this at all? I mean, there might be some amount of weakness, there might be some dryness of the skin, but I do not have any other symptom. I do not have urinary infections. I am not having weight loss. I do not need to get up frequently at night for urination. Then why do I need to take the treatment? And even if I'm taking the treatment, why do I need to have my blood glucose levels to normal levels? Why can't I just take a simple tablet and then just let my sugar levels be whatever they are? We treat diabetes to prevent the complications of diabetes. Long-term diabetes complications. A person who has developed diabetes is bound to develop the complications over 10 to 15 years of duration of diabetes if the diabetes is not controlled. So, the major complications which can occur are the affection of the nerves. You can have tingling, numbness in the feet, burning sensation of the feet, loss of sensation in the feet, foot injury, ulcers which do not heal, etc. Then you will have kidney issues where the kidney loses proteins, the kidney fails to do its function, and over time there will be end stage kidney failure. It can affect the eyes, and this affliction is also very, very silent. Until unless the eyes, the retina is damaged to such an extent, more than 80-90%, we won't have blurring of the vision or eye loss. So that is one thing which the diabetes affects. The diabetes can affect or clog various blood arteries. So if it clogs the arteries of the heart, we might have a heart attack or a myocardial infarction. If it clogs the arteries of the brain, you might have a stroke or a paralysis attack. If it clogs the arteries of the feet, it might lead to gangrene of the foot. So these are the various complications which very commonly are seen in diabetic patients. That is the reason why we try to treat the high blood glucose levels. There is one study which has shown very vehemently if the diabetes or the blood glucose levels are controlled when the diabetes is diagnosed initially within the first couple of months, it gives a very, very long term beneficial effects. So once you're diagnosed with diabetes, control the blood glucose levels, fasting less than 110, 120, post lunch less than 140, 160, and this will give you beneficial results in the long run as compared to a person who has had high blood glucose levels initially and later on who controls them. So whenever you are diagnosed with diabetes, please listen to your healthcare provider when they say that the diabetes should be controlled with these medications. Do not try to delay the taking of medications. You can always discontinue those medications later once the sugars are okay, but do not delay the control of diabetes initially. The second, I think, would be this is the most important slide which I would like to highlight today. This is usually what we discuss in our education forums or in our conferences, but I would like to share this with everyone too. The only reason why I'm highlighting this is to tell that diabetes is a progressive disease. Like I said, if you look at the graph on the lower side, the insulin resistance which increases due to weight and other factors. The body is producing more and more insulin. Here, it is producing more insulin, more insulin, more insulin, trying to control our blood glucose levels. And then there will come a stage where the pancreas will fail. The insulin production will start to go down. The insulin resistance will become stable at that level, and the insulin production will go down. So this is the stage usually where the diabetes is diagnosed in a person. So this stage here, the damage is already been done. Here we come to know about diabetes, and then here we waste our time saying that we don't want this treatment, we don't want that treatment, we'll wait for some more time, I'll do this, I'll do that. And then we reach a stage where the insulin levels or the pancreatic failure becomes irreversible. So here one has to understand that it is not just insulin resistance, but decrease in insulin as well. And with time of diabetes, the insulin level will become so less that a person with type 2 also has to take insulin from outside. So coming to our main topic, what about the medical nutrition therapy? How do we go about it? We have to have adequate nutrients. What are our goals of a nutritional therapy? Have adequate nutrients, including carbohydrates, proteins, fats, micronutrients, omega acids, salt, etc., etc. Achieve an ideal body weight and maintain that weight. Have an individualized diet plan. Like I said, that one size will not fit all. If you try to read from us, from a person, from a blog, etc., that diet plan may have helped that person. You might try it out, but then it is not a guarantee that it will help everyone. Your diet plan should always take into consideration what food habits a person has, where does a person stay, the cultural and customs, beliefs, and the religion of the person, the climate, the profession, the likes and the dislikes, and the socio-economic status. A person who is a pure vegetarian cannot be given high protein diet just like a non-vegetarian person. A person who is living in South India cannot have the same diet plan as a person who is living in North of India. A person who works all day, who has a tiffin or who has to eat out in the afternoons, we cannot advise home cooked fresh food for the person. A person who likes one thing or the other, or a person with a different socioeconomic status, a person who has to have dal and rice, we cannot advise that person to have exotic fruits and vegetables like lettuce, etc. So these are the things which definitely should be taken into account whenever we decide. It is not just about the type of food, but also how we go about it. That is important. And then the most important thing is that it should be practicable. It should be a diet should be that a person can follow for a long time, preferably lifelong. So that are the things which usually should be considered, which I think are the most important things whenever we plan a medical nutrition therapy. So many a times I'm asked in my opinion, which diet is the best? There are many names which people take: keto diet, low calorie diet, low fat diet, vegan diet, Mediterranean. The difference between vegan and vegetarian: vegans, they will not even have dairy foods and eggs. Vegetarian people most often times have dairy products and they may have eggs as well. What is the keto thing? Keto is very low carbohydrate diet wherein you don't eat carbohydrates, and as a result, the diabetes is well controlled, try to lose weight, etc., etc. Then there is low fat diet. There is intermittent fasting, Dikshit diet, wherein people fast for almost 16 hours a day and then have only two major meals. So these type of things, everything is there. The Mediterranean diet, which has been shown that more of olive oil, pulses, fruits, etc. are used, and then less of eggs and dairy products. So as far as medical science is concerned, in the short term, over a year or so, all of these diets will give benefit. There will be short-term weight loss in everything. But then in the long term, none of the diets have shown benefits except for Mediterranean diet for cardiac protection, decrease in the rates of heart attack. All other diets falter. It is not because of the diet, it is because of the motivation. No person can keep on, doing intermittent fasting for the whole of their life. No person can have a keto diet for the whole of their life. So till such a time a person follows these diets, yes, it will help. Once you stop it, the weight will come back. So, what are the things? What are the life hacks which a person can use whenever they're trying to diet? Restrict energy intake, in the sense the low calorie or restriction of calorie dense foods is one simple way to do it. I'll give an example. A burger or a vada pav has almost 400 calories in it. A normal person who has a sedentary lifestyle, overweight, so you will need around 20 calories per kg per day of energy. So an 80 kg person will need around 80 into 20, around 1600 calories per day. And if the person wants to lose weight, he should have 400 calories less. So around 1200 calories a day and not more than that. So the body will get 1200 calories from the food, it will utilize 400 calories from the stored fat reserves. So if a person has to have a 1200 calorie diet per day, and if he has one vada pav, the 400 calories are already gone. The hunger is not satisfied either, and then the person will have to eat much more to satisfy that hunger. How is the person going to then adhere to the 1200 calorie guideline? So herein it is important that we have a healthy choice of food where we change one food for the other. In the sense, instead of having, say, uh, a calorie dense food, we can have some foods which are less in calorie and more in the quantity, like fruit salad or a vegetable salad, say bhel, dry bhel, which will give you less energy, which will also quench the hunger at the same time. The other important thing is portion control. So whatever we eat, if we cut it down by say 30%, and then over time bring it down to whatever is advised for you by the healthcare practitioner or the dietitian, that is one important. I'll just give an example here. Now they say that potatoes and apple. Okay, so a diabetic, it is safe to have an apple. It is not safe to have a potato. Why is that? Because the potato will give you carbohydrates at a faster rate. So if you have say 100 grams of potato and if you have 100 grams of apple, the potato will give you three times more glucose. So should we just stop eating potato? One easy way would be that instead of having 100 grams, have 30 grams of potato. So it will give you the same calories as one apple. So this is what is portion control. Have the food in a lesser quantity so that you get lesser calories. What about exchange food? Now, exchange food will come. I'll just explain that idea to you in the subsequent slide. Then the thing is about mindfulness. This is one important thing. In today's world, we are so much in hurry to do things that we even have to have food in a hurry. We don't give it proper respect and proper time to have our food. We have food while watching television, while talking to people, while discussing a meeting, etc., etc. And then during that time, our mind does not know when the stomach is full, and we just keep on eating food and overfill our stomachs. So that is one thing which should be avoided. Have small morsels of food, chew the food properly, keep your mind on focus on eating the food rather than on other things. And as soon as the stomach gets filled up, it will send signals to your mind and then you can stop your food. That is the importance of mindfulness. Then it is always better to have a family who follows the diet with you or a partner who follows the diet where you can exchange notes, where you can, get motivated from each other. That is one important thing. And then you don't have to do everything yourself. You can't just do everything by googling onto the internet or anything. There are experts who have been studying. They will know what type of food will benefit you, what type of diet advice will benefit you. If something does not work, what are the other options? And you can definitely do it in a better way if you take experts' opinions. One other important thing where you can easily, control your calorie intake is avoiding the situations. In the sense, suppose there is a family get together or there is a marriage party or a ceremony. Have some food at home. Have some home food at say around 7 o'clock or so before you go there. And once you go there, you are already half full. So portion control automatically kick in when you are having food at the marriage or something. And then monitor your progress every month. Look at what is happening. Don't just go blindly and then do the same thing for years together. And after you lose weight, avoid weight regain. That is the most important. People just leave everything in hopelessness, and then the weight regain is double than what it would have been. So usually, what are the various components? We have carbohydrates, sugars, complex sugars. So usually, a diet should avoid simple sugars. Simple sugars are like the sugars, glucose, fructose, etc., which are easily broken by the intestine, and then the sugar levels go high. Complex sugars are starch or fiber. The starch is something which breaks into glucose over time. So high starch foods are like rice, potatoes, which eventually will change into glucose. And then fibers are those carbohydrates which are not easily absorbed. In the sense, the skins of the vegetables or the fruits, the pulp of the fruits, etc., which is not absorbed. So in our diet, it is advisable that we have at least 30% of fibers. It increases the bulk of the stool. It helps with the cholesterol. It helps with removing all the muck from the body and you know preventing allergies and skin rashes, etc. So fibers have multiple benefits. Complex sugars, like I said, rice, potato, they will eventually get converted into glucose. And then there comes the concept of glycemic index. High glycemic index, low glycemic index, and medium glycemic index. So glycemic index is like a quantity of food, how much sugar, blood sugar it will raise. So if you give 50 grams of glucose, it will raise the blood glucose levels by 100. So as compared to glucose, we compare other things. So what are the things which have high glycemic index? There are bakery products. There is white bread, burgers, fast food, corn, etc. Medium glycemic index, pulses, cereals, rice, fruits, vegetables. And then low glycemic index are usually the dairy products and cheese, etc. So we should divide our diet or food where you can have a high glycemic index portion of food combined with a low glycemic index. For example, rice, wherein it is high glycemic index, combine it with dal, which is a low glycemic. So that was the concept which has been traditionally there in our society or in our country, and we have been not following those things. So rice in general is not bad. Just having rice, fried rice, and those rice, it is better to we take rice with vegetables, we take rice with dal, so that a high glycemic index and low glycemic index food is mixed, and the change in sugar, blood sugar levels is not that high. Coming to proteins and fats. So proteins, usually the sources of proteins for a vegetarian person is milk or soy, which is a class 1 protein. Otherwise, non-vegetarian sources are class 1. And then rest of the proteins, pulses, dals, legumes, etc., they are class 2 proteins. So it is always advisable to combine various sources of class 2 proteins like pulses, dals, etc., so that we can have adequate amount of proteins in our diet. Then there is fat. Now, this is one important thing which I would like to focus on. Avoid saturated fats, decrease polyunsaturated fats, and prefer monounsaturated fats. So, what are the oils which are good? Butter, coconut oil, dalda, ghee. These are high in saturated fats. Avoid those. Polyunsaturated fats are present in safflower oil, sunflower oil. Restrict those. And the oils which are good are the olive oil, the mustard oil, the groundnut oil, which has monounsaturated fatty acids. So we can use these oils like groundnut, olive, mustard, the till oil, the rice bran oil. These have monounsaturated fatty acids, and these can be used in cycles, say a month each, so that you have each and every oil which is good in nature rather than having coconut oil, etc. And then how much oil should be used by a person per day? 3 teaspoons. That is it. Or say half a kg or half a liter of oil per month per person. That should be the quantity which we should target. What about the other things? Omega-3 fatty acids, they're usually present in mustard oil, till oil, or in fish. So, 2 portions of fish per week is a good thing to have. What about salt? Not more than 5 grams of salt per day. We Indians usually tend to have up to 10 grams of salt in our daily diet. So, try to avoid to put salt, extra salt in the food. Try to avoid preserved foods like preserved butter. Try to avoid pickles and papad, etc., which have high salt in them. Can we use artificial sweeteners? Artificial sweeteners are safe for diabetes. Though the taste may not be great, though they may leave an aftertaste, it is safe. A person might take time to get used to, but they can be used twice or thrice a day. What about alcohol? Alcohol only gives empty calories. Say a portion of alcohol will give you 100 calories. Once the alcohol is taken, it will go to the liver, and the liver will start to metabolize the alcohol rather than release the glucose which it has stored. So, diabetics, when taking alcohol, have a higher chance of going into low blood glucose. So, for diabetics, it is preferable to avoid alcohol at all. What about methi? This is one thing. These are the things which I have just entered because many of the people ask me. So what about methi? Methi seeds especially. So methi seeds have shown a beneficial effect in diabetes control as well as in cholesterol control, not the methi leaves. So one can have methi seeds. They can put it in foodstuffs, or they can even put it in water and have them at night or so. So meal planning, that is same thing again. Here I'd like to highlight one thing. So what is our daily plate of food which we eat? Half of our plate is filled with either chapati or rice. Then one fourth of it is vegetable, and then one fourth of it is protein like dal or a non-vegetarian food. So we have to change this. Half of it should be vegetables, especially those vegetables which grow above the soil, except for carrots. So we can have half of our plate filled with vegetables only. Vegetables can be used in the form of curry, salad, chutney, or even otherwise the normal way which we cook our vegetables. And then reduce the cereals, the chapatis and the rice from half to one fourth. So a carbohydrate serving should only be one fourth used, and then the remaining one fourth should be the protein. It can be paneer, it can be egg, it can be dals, it can be legumes or fish or chicken, etc. And then one can have buttermilk or a low fat milk. So this is the general thing which everyone can follow. This is the general thing which you can have a portion control with. So one important take home message here is change the carbohydrate from half to one fourth and vegetables from one fourth to. This is just one thing which I wanted to highlight, that whatever fast food we eat, you have to check what you are having. These are the things which we should not have. Limit their excess. Total fat, saturated fat, cholesterol, and sodium. Dangerous for the body. If it has anything more than 5%, avoid that thing. These things are good. Vitamin A, vitamin C, calcium, minerals. Get enough of them. Good food. And then calculate your calories. Always look at the calories, whatever the food has to offer. Look at per serving and look at total amount. Accordingly, control your portion intake. A good way, yes, this is one thing. So, accordingly, control your portion intake. This is just to highlight how the portion of foods has changed from 1960s to 2000s. The number of calories earlier in fries of McDonald's were around 200, and now it's up to 610 with almost 30 grams of fat. Now, this is a dangerous thing. This is what we have to avoid. They give a small packet for 40 rupees and a large packet for 50 rupees, and then we tend to buy these rather than portion control. This is one thing where we can take care. And then coming to the exercise. Now, what is the major problem in this picture? It is a gym, a fitness center, and the people are climbing or going to the gym on escalator. So this is the problem. The underlying problem is enjoyment. There is no enjoyment in work. So until unless you enjoy your exercise, no one is going to follow you. So do the exercise which you enjoy. That is the most important and the basic thing. And exercise in whatever form should be done which is enjoyable. If someone is forced to do something, this type of situation will occur. What are the things which an exercise does to the body? Once you start to exercise, the glucose which is stored in the muscles is start to use up. So the body starts to use that glucose which is stored in the muscle. Once around 5 minutes are done, the body changes from anaerobic to aerobic use of the muscle. Then 5 to 10 minutes later, the glucose which is stored in the liver, it comes out to provide energy. And then 20 minutes later, the fat which is stored in the body is start to, convert into free fatty acids, which is then used for production of energy. So once you begin your energy, the benefits just start on improving and multiplying. The glucose from the muscle, then the glucose from the liver, and eventually the fat stores are started to use. So once a person continues to exercise for longer duration, more and more of the fat stores are utilized rather than the glucose stores. So this is what we have to explore. We have to exploit. And this is the way we should exercise. The exercise It not just helps with the control of the diabetes or blood glucose levels, it helps with the control of blood pressure, cholesterol, it helps in the mental health, it helps to balance, it helps with the bone health, osteoporosis, etc. So, an important thing here is when not to exercise or when to avoid exercise. So, in our zeal to continue exercising, sometimes it can become a harmful thing. So, whenever we are ill, avoid exercising. If someone has a heart issue, if someone has arrhythmias or has undergone a bypass or a heart stent, the exercise should be done in consultation with the cardiologist. A person who is frail and old cannot do the same exercises as a young person. And here again, it is important to note that the exercise prescription should also be individualized. The first thing is the person should undergo medical evaluation by a physician, a cardiologist, and a endocrinologist to see what are the underlying comorbidities, how is the general health of the patient, and how they can go ahead with it. Then it is education about exercising, avoiding complications, and then timing, type, and follow up of the exercise. So usually exercise is done in FIT, fit, frequency, brisk walking, cycling, swimming. These are the exercises which give moderate amount of calories are burnt or moderate intensity exercises. These should be done at least 30 minutes a day for at least 150 minutes a week and not more than 2 consecutive days you should take a holiday. The intensity, yes, moderate exercise for majority of the people. If you are doing vigorous exercise like gymming, aerobic exercise, etc., then it can be done for twice a week in majority of the people for say 25 to 30 minutes. What is the type of exercise? Usually aerobic, walking, cycling are the things which we prefer. Some people might prefer dancing or Zumba also. And like I said, time usually preferable in the morning or if not, whenever one has time, the exercise can be done. Which is the best exercise? Walking is the best exercise. No investment except for good shoes and easily done by everyone. No issue of knee pains, etc. And one important thing a person should know is how much calories they burn whenever they exercise. Usually 200 to 400 calories with various exercises. The last important thing which I'd like to highlight is that a person should keep healthy. No sedentary lifestyle. Every hour, get up for at least 5 to 10 minutes, move around so that the body is used to it. So 30 minutes of moderate exercise, walk, do not sit and watch television. So the last thing that I'd like to highlight is the difference between the Western people and the Indians. This was the famous study which was done by Yagnik from an endocrinologist from Pune and his friend Yudnik, who was an endocrinologist in the US. So he had come to India for some marriage, and at that time this picture was taken. And later on, they found that the BMI of both of these persons is same, 22.3, but the body fat content in the American person was 9%, while the Indian had 21%. This is the fat content in the body. So Indians have, for the same BMI, higher fat content. They are at the higher risk of diabetes. They are at higher risk of development of diabetes. So we would rather not blindly follow the recommendations which are given to the Western people, which are easily found, and should be individualized for our own people and follow those instructions rather than just a blanket. So the first step is always the hardest step, and the distance is nothing. It is only the beginning or the first step which has to be taken. And once the ball starts rolling, then no one can stop it. I hope everybody has taken some take home points from the talk today. Thank you so much for listening, for the patient listening. Thank you.